Okay, so we're going to start off by doing an examination of the cranial nerves, and we're going to talk it through as we go so you understand why we're doing what we're doing at the time. Okay? So, hi Russell, my name's Dr. Jones. Is it okay if we examine the nerves in your face?
Yes.
Okay, that's great. So I'm just going to start off by lifting the bed a little bit higher, just so you're a little bit nearer me, okay? It's customary to start the cranial nerve examination by inquiring as to the patient's sense of smell. So, Russell, have you noticed any problems with your sense of smell recently?
Not as far as I've noticed, Doctor.
We're then going to go on to start to examine the second cranial nerve. So the first thing I'd normally do is check his pupillary responses. This is a relatively brightly lit room, and if necessary you can dim the lights to help with this. Russell, just look straight ahead for me. And you check the direct pupillary response in either eye. And then you check for any evidence of a relative afferent pupillary defect by swinging the torch from one eye to the other. And the next thing we'd normally do is check visual acuity, and ideally you'd use a standard Snellen chart for that. We don't have one of those today, so we'll just proceed otherwise. Russell, I'm just going to shine a light in the back of your eyes. What I'd like you to do is I'd like to look at a point in the distance and just concentrate on it and try and keep your eyes as still as possible.
Okay, Doctor.
So we check for a red reflex, and then we come in a little bit closer. So we make sure that the disc is okay, that there's no evidence of papilledema. And then we have a little look around to make sure the rest of the retina looks healthy. And then we'll just come across to the other eye and check that one. Keep looking straight ahead. And that's great. The next thing we'll do is check his visual fields. So Russell, would you mind looking straight at my face? Can you see the whole of my face?
Yes, okay.
No parts of it are missing?
No.
Okay, that's great. Just cover up your right eye for me. I'm going to bring this red hat pin in from the edge of your field of view into the middle. I want you to tell me when you can first see the red hat pin.
Now.
Okay. And again.
Now.
Keep your eye on my eye. Tell me when you can first see the red hat pin. And again, tell me when you can first see the red hat pin.
Now.
Great, let's swap hands. Same again, keep your eye on my eye. Tell me when you can see the red hat pin.
Now. Now.
Keep your eye on my eye. Tell me when you can see it.
Now. Now.
Great, okay, that's fine. Next thing we're going to do is we're going to check for your blind spot. What we're going to do here is we're going to bring the hat pin in from the edge of your field of view. At some point it'll disappear, that's normal. It'll disappear for me as well, and I'll compare my blind spot with your blind spot. Okay, so just cover up one of your eyes again. And that's great. Okay, so when it comes from the side, you can see it there?
Yes.
Tell me when it disappears.
Now.
Tell me when it reappears.
Now.
Is it gone again?
It's gone.
And then we check when it reappears.
It's reappeared.
Tell me when it reappears down here.
It's reappeared.
That was great. By confrontation, your blind spot was exactly the same as my blind spot. We'll just check your other eye.
Okay.
So cover it up. That's great. So we'll just check the other eye now, coming in from the side. Tell me when it disappears.
Now.
Tell me when it reappears.
Now.
Has it gone again?
Yes.
I'm going to move it upwards.
Reappeared.
Good. And now I'm moving it downwards. Has it gone again?
It's gone again, yes.
Tell me when it reappears.
Now.
That's great. Okay, that's fine. So the aim of checking the blind spot with the red hat pin is to compare your blind spot with the patient's blind spot. You simply move it in from the edge until it disappears. Keep moving it until it reappears, comparing it with your own. Move it back into the area where it disappeared and then check it in the up and down position just to make sure the blind spot as a whole is approximately the same size as your own. Next thing we're going to do, Russell, is check the eye movements. What I'd like you to do is I'd like you to follow my finger with your eyes. Keep your head as still as possible.
Okay.
Let me know if you get any double vision whilst we're doing this.
Okay.
Okay? So when you're doing this, you need your finger to be approximately a metre away from the patient. You don't want them to start converging. And keep your eye on my finger, follow it, keeping your head still. So you perform a sort of H shape to check the eye movements, and then you check the vertical eye movements. That's great. So we've checked his pursuit movements. What we want to now is test his voluntary eye movements, his saccades. So Russell, what I want you to do this time is look straight at my nose, and then I want you to look at my finger when I click it. Keep your head as still as you can, look at my nose. And again, and again. Okay, keep looking straight at my nose, keeping your head still, look up, look down, look up, look down. That's fantastic. Right, I'm just going to test the sensation in your face now, if that's okay. I'm going to touch you here and here. Can you feel that okay?
Yes.
Does it feel the same on both sides?
Yes, it does.
I'm going to touch you here and here. Does it feel the same on both sides?
It does.
And here and here.
Yes.
Same on both sides?
On both sides.
Okay, that's fantastic. You might also want to test for a corneal reflex here using a piece of cotton wool and just dabbing it gently on the eye, but you don't routinely do that as part of the examination unless you think someone has a trigeminal nerve deficit. I'm going to now test the strength of the muscles in your face. So what I'd like to do is raise your eyebrows right up. That's great. And close your eyes as tightly as you can, like I'm doing. Really tight. Keep them closed. Don't let me open them up. Good. Keep them closed. Don't let me open them up. Good. And relax. This time close your mouth as tightly as you can. Don't let me open it up. That's great. Don't let me open it up. That's great. Fantastic. Relax. The next thing I'd like to test, Russell, is your hearing, if that's okay.
Yes.
So I'm just going to block one ear off, and then I'm going to rustle my fingers in front of your other ear. I want you to tell me if you can hear it, okay?
Okay. Yes, I can.
And then the other ear.
Yes, I can.
That's great. Okay. The next thing I'm going to do is I'm going to take a look inside your mouth, if that's all right. So I want you to open wide. Okay. And just push your jaw open against my hand, hard as you can. That's good. Clench your jaw. That's fine. Open wide again. And say, ah.
Ah.
That's fantastic. Okay, next I want to test the strength of some of your muscles. So I'd like you to shrug your shoulders up like this for me. Keep them shrugged up. Don't let me push them down. That's great. Okay, just relax. Now I'd like you to look over one shoulder for me. Keep your face there and push as hard as you can into my hand. I'm just feeling the sternocleidomastoid muscle there to make sure that it's engaged. That's great. Try the other side. And push into my hand. That's fantastic. Just relax. Finally, going to have one more look at your tongue. I want you to open wide, making sure you haven't missed any evidence of wasting or fasciculations in the tongue. Now, Russ, I'd like you to stick your tongue out and wiggle it quickly from side to side. That's great. Put your tongue back in. This time I'd like to push your tongue into your cheek, hard as you can. And the other side, hard as you can. Okay, that's great. And that's the cranial nerve examination finished.